App raises public awareness of the importance of COVID-19 vaccination.
In response, the World Health Organization wants everyone to stay at home and
play video games. In addition, some of the condition for the World Health Organization to end the coronavirus lockdown are the transmission is controlled and the community to be fully educated, engaged and empowered to live under a new normal. The studies, published in the Lancet, early rate reductions of SARS-CoV-2 infection and COVID-19 in BNT162b2 vaccine recipients, Sharon Amit et al. 2021, find COVID-19 vaccine reduces transmission. Therefore, one of the best solutions is to create an app raises public awareness of the importance of COVID-19 vaccination. Vaccinate effective against COVID-19 and safe. The studies, published in the Lancet, Sputnik v COVID-19 vaccine candidate appears safe and effective, Ian Jones et al., 2021, vaccine efficacy, based on the numbers of confirmed COVID-19 cases from 21 days after the first dose of vaccine, is reported as 91.6%. And the suggested lessening of disease severity after one dose is particularly encouraging for current dose-sparing strategies. The studies, also published in the Lancet, Oxford AstraZeneca COVID-19 vaccine efficacy, Maria Deloria Noel et al., 2020. No COVID-19 related hospital admissions occurred in CH-ADOX1-nCoV-19 recipients, whereas 10, 2 of which were severe, occurred in the control groups. Vaccine efficacy for the pre-specified primary analysis, combining dose groups against the primary endpoint of COVID-19 occurring more than 14 days after the second dose was 74% of 5,807 participants in the CH-ADOX1-nCoV-19 group versus 101 of 5,829 participants in the control group. A study, Safety and Efficacy of the BNT162b2 mRNA COVID-19 Vaccine, Fernando P. Pollack et al., 2020, a two-dose regimen of BNT162b2 was found to be safe and 95% effective against COVID-19. The vaccine met both primary efficacy endpoints, with more than a 99.99% probability of a true vaccine efficacy greater than 30%. These results met our pre-specified success criteria, which were to establish a probability above 98.6% of true vaccine efficacy being greater than 30%, and greatly exceeded the minimum FDA criteria for authorization. Mutation does not dramatically undermine the vaccine's protection. The studies, published in Nature Medicine, Efficacy et al., 2021, suggest the variant's key mutation, known as E484K, does not dramatically undermine the vaccine's protection. Study engineered 3 severe acute respiratory syndrome coronavirus 2 SARS-CoV-2 viruses containing key spike mutations from the newly emerged United Kingdom UK, and South African SA variants, N501Y from UK and SA, 69/70th deletion plus N501Y plus D614G from UK, and E484K plus N501Y plus D614G from SA. Neutralization geometric mean titers (GMTs) of 2162 billion Bhutanese Ngultrums 2 vaccine elicited human sera against the 3 mutant viruses were 0.81 to 1.46-fold of the GMTs against parental virus, indicating small effects of these mutations on neutralization by sera elicited by 2 BNT162b2 doses. App raises public awareness of the importance of COVID-19 vaccination. Version 4 is an extension application game-based learning to prevent infection from COVID-19. Version 3. External prevention. In the app, player can touch or press the photo, hand washing, which means that player are using a hand washing strategy to prevent COVID-19, so the COVID-19 red viruses becomes a dead virus black. In any case, dead virus black will become COVID-19 red for a short time. Therefore, if player want to use the hand washing strategy to prevent COVID-19 infect him, he need to do frequent touch or press the photo hand washing. It tells you that in reality, you need to frequently wash your hands to prevent COVID-19 infect you in reality. For the app, version 3, for the second wave of COVID-19 using the mask strategy, all viruses will disappear, which is very effective. But for the app, version 4, for the third wave of COVID-19 using the mask strategy, touch or press to cover the photo, the COVID-19 red virus became a dead virus black. In any case, if the player does not use the mask, leave or release the mask photo, the dead virus black will become COVID-19 red. The effectiveness of the mask strategy has decreased. The reason for this change is that the lockdown strategy of some country is a change from the second wave of COVID-19 and the third wave of COVID-19. For the second wave of COVID-19, certain countries can still stop operate of most companies and providing some funds to these companies, but this has had a huge impact on economic countries. Regarding the third wave of COVID-19, many companies are allowed to operate because some country cannot stop operate of most companies from having a huge impact on economic countries again. As we know, workers cannot wear masks when eating. For the third wave of COVID-19, the mask strategy effect is smaller. In any case, vaccination can solve most mask strategy problems. If people have been vaccinated without a mask, they still have 95% ability to prevent infection. These can prevent workers from getting infection while eating. However, to ensure that there is no infection, everyone who has been vaccinated still needs to wear a mask. Vaccination to reduce symptomatic and asymptomatic transmission. A preprint study, published at medRxiv, decreased SARS-CoV-2 viral load following vaccination. Matan-Levine-Tiefenbrunn et al., 2021, analyzing positive SARS-CoV-2 test results following inoculation with the BNT162b2 mRNA vaccine. Find that the viral load is reduced fourfold for infections occurring 12 to 28 days after the first dose of vaccine. These reduced viral loads hint to lower infectiousness, further contributing to vaccine impact on virus spread. Studies, published in the Lancet, transmission of COVID-19 in 282 clusters in Catalonia, Spain, a cohort study, Michael Marks, Ph.D. et al., 2021, interpret the viral load of index cases was a leading driver of SARS-CoV-2 transmission. The higher the viral load, the greater the transmissibility of the virus. Data analysis in a study by the Israeli Health Ministry and Pfizer Inc. found the Pfizer vaccine developed with Germany's BioNTech reduces infection, including in asymptomatic cases, by 89.4% and in symptomatic cases by 93.7%. Studies, published in The Lancet, Sharon Amit et al. 2021, early rate reductions of SARS-CoV-2 infection and COVID-19 in BNT162b2 vaccine recipients. The Lancet Medical Journal found that among 7,214 hospital staff who received their first dose in January, There was an 85% reduction in symptomatic COVID-19 within 15 to 28 days, with an overall reduction of infections, including asymptomatic cases detected by testing, of 75%. Due to Vaccinate can control and reduce transmission, so Vaccinate can help restoring global economy with lowest risk. In this app, if the player vaccinates each silent carriers will only spread one virus, while those silent carriers that have not been vaccinated will transmit 5 viruses respectively, a reduction of 80%. The purpose is to let everyone know why vaccination can help control and reduce transmission. The app will display this information, especially in highly infectious countries, L4. At level 4, there are 5 silent carriers at the beginning. If the player does not vaccinate the existing 5 silent carriers, when the third COVID-19 arrives, the 5 silent carriers will spread 25 new viruses. However, if the player vaccinates the existing 5 silent carriers, when the third COVID-19 wave comes, these 5 silent carriers will only spread 5 new viruses, thus reducing the L4 virus by 80%, which will enable the player easily win the L4. COVID-19 vaccination can reduce viral load, reduce transmission, and prevent hospitalization and death. The studies, published in the Nature Communications, SARS-CoV-2 viral load is associated with increased disease severity and mortality. Jesse Fain-Zylber, et al., 2020, report that higher levels of SARS-CoV-2 plasma RNA had the strongest relationship with disease severity, key laboratory markers, and mortality. SARS-CoV-2 plasma viremia is commonly detected in hospitalized individuals but can also be detected in symptomatic non-hospitalized outpatients diagnosed with COVID-19. SARS-CoV-2 viral loads, especially within plasma, are associated with systemic inflammation, disease progression, and increased risk of death. Vaccine offers 100% protection against coronavirus hospitalizations and deaths. Johnson & Johnson's one-shot vaccine generated strong protection against COVID-19 in a large, late-stage trial, raising hopes that it can rapidly reshape a stumbling immunization campaign. In the more than 44,000-person study, the vaccine prevented 66% of moderate to severe cases of COVID-19, according to a company statement on Friday. And it was particularly effective at stopping severe disease, preventing 85% of severe infections and 100% of hospitalizations and deaths. Vaccine AstraZeneca confirms 100% protection against severe disease, hospitalization and death in the primary analysis of Phase 3 trials, a preprint. The Lancet, single-dose administration, and the influence of the timing of the booster dose on immunogenicity and efficacy of ChAd-OX1-nCoV-19 AZD1222 vaccine. Merin-Voisey, et al., 2021. The study found 17,177 baseline seronegative trial participants were eligible for inclusion in the efficacy analysis, 8,948 in the UK, 6,753 in Brazil and 1,476 in South Africa. With 619 documented NAD plus VE infections, of which 332 met the primary endpoint of symptomatic infection greater than 14 days post-dose 2, the primary analysis of overall vaccine efficacy greater than 14 days after the second dose, including LD, SD and SD groups, based on the pre-specified criteria, was 66.7%. There were no hospitalizations in the CH-ADOX1-nCoV-19 group after the initial 21-day exclusion period, and 15 in the control group. In addition, in the app, if player do not vaccinate silence carrier. When the third wave of COVID-19 begins, when player approach a silent carriers, player are easily infected because the infection of the silent carriers is highly contagious. Chinese expert Zheng Nanshan said that the infection of silent carriers is highly contagious. Even if isolation is implemented, the rho value may reach 3 or even 3.5, which means that one person can infect 3 to 3.5 people. This number is very high. But if the player vaccinates the silent carrier, since the vaccine silent carrier will reduce the viral load, when the player approaches the vaccine silent carrier, the player is not susceptible to infection COVID-19. As we have seen, most countries have adopted many strategies previously, such as cleaning a place to become a safe area, but unvaccinated silent carriers without masks can turn clean public places into dangerous public places cause unvaccinated silent carriers have high virus load. We see that countries like the United States previously are trying to use large-scale testing to solve COVID-19 problems. But those who test negative will become positive viruses in dangerous public places. This is happening in the United States previously, and despite many strategies used previously, it is still highly infected. The studies, higher viral loads in asymptomatic COVID-19 patients might be the invisible part of the iceberg. Imran Hassanoglu et al. 2020, this study demonstrates that asymptomatic patients have higher SARS-CoV-2 viral loads than symptomatic patients. The study, Transmission of COVID-19 in 282 clusters in Catalonia, Spain, a cohort study, Michael Marks, Ph.D. et al., 2021, as mentioned, interpret the viral load of index cases was a leading driver of SARS-CoV-2 transmission. The higher the viral load, the greater the transmissibility of the virus. Therefore, the above research supports Chinese expert Zheng Nanshan's statement that silent carriers are highly contagious. Oxford study says COVID reinfection, highly unlikely, for at least 6 months. Centers for Disease Control and Prevention says cases of reinfection with COVID-19 have been reported, but remain rare. The studies, COVID-19, past infection provides 83% protection for 5 months but may not stop transmission. Elizabeth Mahassay 2021, the researchers calculated that adjusted odds ratio was 0.17 for all reinfections compared with PCR-confirmed primary infections, equating to 83% protection. The median interval between primary infection and reinfection was over 160 days, when looking at only symptomatic cases supported by positive PCR results. Previous infection reduced the odds of reinfection by at least 90%. The study team stressed that these results give no insight into the effects of vaccines or the new more transmissible variant in the UK, because of the time period analysed. In this app, if the player does not vaccinate the silent carrier will be infected again after a period of time. Calculate the incubation period from any level to the third COVID-19. The estimated incubation period of the app is 10 days, which is equivalent to X seconds for different levels, and the incubation period for each level is different. It is also estimated that 5 months is equal to 150 days, which is equivalent to 15x seconds for each level. For example, for level 1, the incubation period is 10 days, which is equivalent to 25 seconds for level 1. Therefore, 5 months is equal to 375 seconds or 6 minutes and 15 seconds. Therefore, after 375 seconds at level 1, if an unvaccinated recovery silent carrier encounters a virus, it will be infected again. In this app, if player encounter ordinary people, the number of silent carriers will not decrease. However, if player encounter silent carriers, the number of silent carriers will decrease by 1. It should be reminded that if the player does not vaccinate ordinary people, when ordinary people encounter the COVID-19 virus, they will become new silent carriers, and the number of silent carriers will increase by 1. In fact, if you are not vaccinated today and test negative for the virus, then after that, if you are not at home and go out without wearing a mask, then you can easily get infected and test positive for the virus. Vaccination still needs to follow the preventive COVID-19 strategy because the vaccine cannot be fully immunized. It has been found that the current vaccine's immunity against COVID-19 can reach up to 95%. That means that there is still a small chance that you could get infected, so you need to continue to follow preventive COVID-19 strategy. You might be asymptomatic, so you can still spread the COVID-19 virus to others. Vaccines just can reduce asymptomatic transmission. For more features of this application, everyone is also welcome to play this game. The app is not designed for entertainment, but to raise public awareness of the importance of COVID-19 vaccination. For more information, effective prevention strategies to reduce the spread of COVID-19. Everyone can watch my invited talk video icon mesh 20 effective prevention strategies to reduce the spread of COVID-19 https://uu89i8u05qs and online course Basic Learning to Prevent COVID-19 https://youtube.be/z1yovawi. Everyone can get my application article, version 3, in the World Health Organization, WHO, Europe, PMC, some SSRN journal, some medical specialists e-journal and preprint The Lancet. The main purpose of the app is to raise public awareness of the importance of COVID-19 vaccinations so that everyone, especially students, knows the importance of COVID-19 vaccination. In addition, the app has also raised the public's awareness of the importance of following EIP and must concentrate on finding silent carriers like China to prevent any serious infections from the subsequent COVID-19 wave. Because vaccination can help control and reduce the spread of any country in the third COVID-19 epidemic, it can also help prevent hospitalizations and deaths caused by the coronavirus. Vaccination helps restore the global economy with the lowest risk. In fact, we can see that after the United States provided citizens with vaccination and implemented mandatory masks, the number of new daily cases in the United States has dropped sharply. In addition, the number of new deaths per day in the United States has also fallen sharply, indicating that vaccination strategies and mandatory mask strategies are important. However, we also need to prevent the emergence of similar new viruses to prevent the global economic burden and health threats from being more affected. The important thing is that we need to find an effective strategy to solve the above problems if the above problem occur. The purpose of this app design is to solve the above problems, not just COVID-19. For example, if we wear a mask, the mask can stop not only COVID-19 droplets, but also any droplets in any virus. Enhancing our human immune system can also make our body resistant to any virus, including COVID-19 and any mutant COVID-19 virus. By adopting a healthy lifestyle strategy, internal prevention strategy, to strengthen the human immune system, any country can have healthy citizens, which can reduce the medical expenses of any country such as Malaysia. In addition, if a country has healthy citizens, it will definitely increase the country's productivity. Therefore, if any country follows the APP strategy, then it not only can prevent the infection of COVID-19 and the above-mentioned problems, but also reduce medical expenses in any country and increase the country's productivity. It will help any country recover its national economy faster. Acknowledgements. Special thanks to Malaysian Minister of Health, Datuk Sri Aham Baba, for recommending this application, version 3, to raise public awareness and educate the public to prevent COVID-19 infection. Thanks also to the media for reporting on this application, version 3. Special thanks also SSRN for helping to share this app article, version 3, with the World Health Organization, WHO, European PMC and some medical specialist e-journal.
Prevent infection COVID-19 game now available for computer window, tablet, Windows and Android, and handphone, Android.
Thanks for listening.